Welcome, everyone. Thank you for joining the National Park Prescriptions Initiative's first webinar on creating and strengthening park prescription programs. This is the first in a three-part series where we'll be focusing on the importance of different aspects of a park prescription program, and today we'll be focusing on partnerships. And so this is this webinar is sponsored by Kaiser Permanente, and it is hosted by the National Park Prescriptions Initiative. The National Park Prescriptions Initiative is led by the National Recreation and Park Association, the National Park Service, and the Institute at the Golden Gate. The Institute at the Golden Gate organized these webinars with support from Kaiser, and we have a big thank you to Leah Casa, who was organizing all of the webinars. So for everyone on the webinar today, we'll be using the GoToWebinar system. And so to hear the audio, you can look at the numbers on the screen and enter them onto your computer. And then if you have any questions for troubleshooting, please visit the website that's listed. And if you have any questions for the moderator or the panelists, please use your questions box, and we'll be monitoring those, and we'll have a time dedicated towards the end for questions and answers. And so the agenda for today is that we're going to have panelist presentations, and we're going to be hearing from 3 park prescription panelists. We're going to have a Q&A session, and then we're going to have closing remarks. And for our speakers today, I'm your moderator. I'm Donna Leong, and I'm the Health Program Manager at the Institute at the Golden Gate. We'll have first Zarnaaz Bashir, who is the Vice President of Health and Wellness at the National Recreation and Park Association, Dr. Curtis Chan, who is the Medical Director of Maternal, Child, and Adolescent Health at the San Francisco Department of Public Health, and Howard Levitt, who's the Director of Communications and Partnerships at the Golden Gate National Recreation Area. And so the National Park Prescriptions Initiative is a national community of practice that is really trying to bring together all of the practitioners who are trying to put on and have their own park prescriptions programs. We're trying to communicate best practices and lessons learned from across the nation in terms of what has and hasn't worked for park prescriptions. We know that there are many different ways to create a park prescription program, and we're hoping to expand the knowledge base. You can learn more at ParkRx.org. And what are park prescriptions? So I know that everyone on the phone has a different park prescription program in their mind. You either prescribe time in parks or you prescribe a program in parks. And we know that there's a wide variety, and what we're trying to do is to create a coordinated movement. And so the definition for park prescriptions is programs designed in collaboration with public land agencies, healthcare providers, and community partners to encourage people to utilize parks, trails, and open space for the purpose of improving individual and community health. This is a working definition that is put in place by the National Park Prescriptions Initiative, and it was formed during the first convening in 2013. And so about the audience on the line today. So thank you all for joining this webinar, and we have a breakdown of quite a few different sectors involved in park prescriptions. And so you can see that here are some general statistics on the audience members of this webinar, and we're really hoping that you can take something away from this webinar to incorporate or to improve on your own park prescription program. And so we'll get started with panelists right now, and we'll get started with our first learning objective, which is that participants will learn why partnerships between different sectors is essential for park prescription programs, and what do some successful partnerships look like. So first on the line is Zarnaaz Bashir, who is the Vice President of Health and Wellness at the National Recreation and Park Association.
Thank you, Donna. I'm really excited to be on the line today, and I'm going to be talking about partnerships, why this is important for park prescription programs. All right. And so being at the national level, I'm with the National Recreation and Park Association. We represent all the local park and rec agencies across the country. And as Donna pointed out, I'm also part of the National ParkRx initiative. And I feel like we've been really lucky to have the opportunity to see so many different programs that are out there and really understand what works well and what doesn't work well. And as Donna pointed out, it's really important to note that what works for one community may not work for another. And so we've seen the national landscape of park prescription programs work very differently from one community to another. But one aspect that has been pretty consistent in terms of among the most successful ParkRx programs has been having the right team of partners in place, and ideally having that established from the very beginning of when you create your park prescription program. And so Donna mentioned earlier the definition that was established by the National ParkRx initiative that's up there on your screen right now. And I really want to emphasize programs designed in collaboration with. When you are working in collaboration with your partners, with the providers and the parks, all working together in the design phase, we tend to see a lot of success. I always share this story of one program that I had talked to months ago, and they created a lot of resources. This was a park department that created a lot of resources for their park prescription program, and it was ready to go, and then they approached their healthcare providers and weren't getting a lot of interest. And it's not necessarily because the physicians didn't want to use it, but had they talked to them, you know, at the very beginning phase to understand what their needs were and what would work for them, they would more likely see success and be able to move together in the right direction. So collaboration in the design phase is really ideal. And just working together, sharing resources, and combining talents really do lead to positive health outcomes. It's a partnership that makes a lot of sense. So NRPA in early June released a survey to a sample of some of our members just to see how many park prescription programs are out there, what are people working on, how are they evaluating their programs, who are they partnering with, all sorts of questions. It was a very quick and dirty survey. We got 115 responses back. But 22 of those are what we considered, based on our definition, a park prescription program. And what we found is typically, you know, parks are working with healthcare providers, their health departments, and hospitals and hospital systems to run their park prescription programs. But what we were also, you know, enlightened to see was that park agencies are drawing from a diverse set of partners to deliver their park prescription programs to the public. As you can see on the screen right now, you know, libraries, that was really unique, working with universities to help evaluate their programs, social workers and mental health. A lot of these make a lot of sense, but it was just interesting to see that there's a whole system of partners that are working within the park prescription model. And so in terms of what works well, from what we have heard, talking to park prescription programs out there, criteria for a successful partnership, and of course, you know, this isn't the end-all list here, but these are just some of the lessons learned that we've heard. Finding a natural park champion, at least from the park side, what we hear a lot is it's hard to find that healthcare provider that's on board with this. And I'm sure that could work vice versa. You might have a provider that's really on board with working with parks but might not have a park available to work with them. But what we find are some good park champions out there. You know, the medical professionals, you find that they might be busy with their everyday jobs, but many of them are champions. Many of them have grown up in parks, or they see the value that parks and nature bring to their patients. And some of them, you know, they might be even frustrated that their treatments aren't working and they're willing to try something innovative and new. But it is really important to find that champion because it really adds to credibility of your program and can also help bring some of the other physicians and healthcare providers on board with your program. Also promoting parks and what they offer. What we've heard is a lot of patients out there, a lot of people out there don't necessarily associate their neighborhood park as a place of wellness, and so there's a lot of educating that needs to happen around that. There are often times where people might not even realize that they have a park right in their backyard, so helping them understand where the parks are and also that they have these resources available in their neighborhood. What are the programs and facilities that that park has to offer? That's really important to promote. Creating a supportive environment. Is the park safe? You know, are you asking people to walk on the trails, but your trails are blocked? Or is the playground equipment old? People need to feel secure, and the providers want to feel secure that the programs that they're sending their patients to are meeting the needs of their patients in a safe way, that they're also more likely to continue to go to the park. And some things might sound really simple, like older population, when they want to take a walk in a park, are there benches along the walking paths? Then they are more likely to access that park or use the park. There were stories about a park that liked to close their bathrooms on weekends, and that made it hard for some of the walking groups to access the park. So thinking about just making it very user-friendly and a good experience for people to want to come to the park. Ensuring safety, again, I talked about that a little bit, but you know, the providers want to make sure that where they are prescribing wellness to their patients is a safe place, and that's really upon the park system to ensure that they're creating a safe environment for their users. This one is a big one, having a package ready to go. Where we see park prescription programs working really well is where the park has that pre-established program already in place that, you know, people are going through. It's evidence-based, and the provider can just plug into it. Something that's accessible and safe, and it doesn't require providers to do much investigating on their own on whether it's appropriate. What we hear is providers do not want to refer their patients to a situation that is not well run or unsupervised. So again, this is important for if a park has a program all ready to go and packaged, that tends to be really successful for park prescriptions. And finally, a feedback loop. There needs to be two-way communication between the parks and the healthcare providers and all other partners that are involved. That includes feedback and information sharing, and that leads to great success for the park prescription programs. And so I'm going to close by saying, you know, given what we've seen over the last year or two, I think the medical community will likely be turning more and more to parks to get their patients healthy. We've been seeing the number of park prescription programs happening locally across the country really grow, and that's great. You know, parks are safe, accessible, affordable, and right in people's backyard. And for many people, you know, going to a gym can be intimidating, and there are other, you know, issues related to it like cost and transportation. And, you know, for parks, I would say helping patients understand what resources they have in their neighborhoods is really important. And if it's familiar to them, they will do it. And so this is a partnership that just makes a lot of sense, and not just for improving people's health, but it's also leading to greater awareness of parks in the community and more users in parks and improved access to parks. And so with that, I hope everyone is pumped to create more partnerships or strengthen their existing partnerships. And I'm going to give it back to Donna to set up the next speaker.
Great. Thanks, Zarnaaz. And so we'll be hearing from our next speaker, who's going to really give us some medical and public health perspective in terms of the partnerships needed to create cross-sector partnerships for park prescriptions. And so our next speaker is Dr. Curtis Chan, who is, again, the Medical Director of Maternal, Child, and Adolescent Health from San Francisco Department of Public Health. Take it away, Curtis.
Good day. Thanks for the introduction. I'm trying to forward the slide with the arrows, seeing if I have control yet. So if you could forward the slide, and I just want to affirm Zarnaaz's great comments about the two different sectors, and I wholeheartedly agree. So one hat that I had worn in the past is as a pediatrician, so in terms of being partners with. So practicing physicians and healthcare providers really understand the community and can really utilize the park prescriptions and the programs that the park community can develop. So, but when I was a practicing pediatrician, I would be seeing patients 40 to 60 hours a week. Whereas, so I don't have that much time and opportunity to be actually attending meetings. So in contrast, so my role as Deputy Health Officer and Medical Director of Maternal Child Health, every state and most counties throughout the country, and looks like we have nearly 200 participants, have a physician who's in a similar position as me. And now my days are typically reading emails and going to meetings. So the opportunity to meet with parks folks is actually a wonderful thing for me, and probably a wonderful thing for your counterparts throughout the country. And the results of our meetings and partnerships in San Francisco result in this newspaper article that was on the front page of one of our local papers, The Examiner, and it really shows that the great work of our park partners in developing consistent programs in which physicians can prescribe on a regular basis. And you can see that having that consistency available then becomes a news story that supports the tremendous value of parks. Trying to go to next page now. I'm sorry, my arrows are not working. Can you forward to the next page? Oh, super. So the way we were able to make it a newspaper article was basically the parks departments here in San Francisco, which is a combination of federal, state, and local city county parks, all agreed to provide consistent programming throughout the year. In the case of San Francisco, they agreed to provide free fun walks that happen every Saturday in San Francisco's beautiful parks. And they've agreed that all these parks will be led by park staff, and they will be designed for all ages and abilities to welcome people who have not been very physically active in the past, and to help people become physically active, be intentional about reducing stress, emphasize that this was a way to maintain a healthy body, bones, and muscles, and really to add a component of social connection, a welcoming introduction, and getting to know each other at every single event. So this type of standardization is what provides confidence for physicians to prescribe something. So you could imagine that a physician is trained to really understand the medications they provide and prescribe. And also, if they refer to a subspecialist, say a cardiologist or a surgeon, they have developed a relationship with them and they understand the quality of their work. So the park departments, in our case here in San Francisco, have been supremely committed to that idea and have just done a wonderful job to make that happen. So next slide, I'll try to forward again. Oh, it worked. And this is, this is the summary of our collective impact planning document. So most public health, social service agencies, and education agencies are now utilizing a collective impact framework or something similar to that. So it's similar to collaboration, but we're trying to be very intentional with 5 different conditions, which are on the left side: a shared agenda, shared measurement, mutually reinforcing activities, continuous communication, and having a backbone agency. And you could see what's really brought us together is that we've discovered that county park agencies and county public health and regional healthcare organizations have this shared agenda to improve health and well-being for the residents. And what we share specifically is that we would love to increase access to nature and recreation in nature for our patients and our residents. Because, as you can see down for shared measurements, park agencies, which are funded by taxpayers, share the same commitment as public health departments in reducing the prevalence of disease that impacts us the most, such as depression, anxiety, toxic stress, social isolation, chronic disease, physical inactivity, and obesity. You can see that all highlighted in the yellow section in the middle. Those are our common indicators that most counties actually have prevalence data to support. And off to the side, the shared measurements are our performance measures that each of our agencies can have. As you can imagine, by having a park prescription, physicians are now more likely to screen for things like physical inactivity, isolation, and depression, because now they actually have a good place to refer patients to if a patient says that they're physically not active, instead of recommending just vaguely to be physically active. They can actually provide specific information. So with that, you're able to see the mutually reinforcing activities. Now, parks and healthcare are both committed to equity and serving underrepresented communities. And parks in San Francisco have developed these consistent activities that welcome underrepresented communities. And in turn, healthcare is now able to prescribe these community resources that promote health. Next slide. So a few references I think that would be very useful as you approach your public health and healthcare agencies is to be aware of some of these documents. The first thing is the National Prevention Strategy. You could just Google this, but you could see both on the top left side and the top right side is that public health and parks can develop healthy and safe community environments. And then on the right part of the circle is clinical and community preventive services, and you could see that's described as our San Francisco Health Network in San Francisco, are the actual healthcare providers who are providing services, those seeing patients, those 40 to 60 hours a week I'm talking about. So this is a key document to attach to grants. And your next slide, oh, it's working now. Oh, no, I did it myself. And these are excerpts from that National Prevention Strategy, and you could see that recommendation 1, 3, and 5 describe things that parks can do on 1 and 3 in terms of designing, and I like Zarnaaz's comment about co-designing with public health. Safe, accessible, affordable places for physical activity, and once that's available, clinicians could do number 5. Assess physical activity levels and provide education, counseling, and referrals within the clinical environment. So that's all within the National Prevention Strategy. And foundations are interested in this too. So this is from the Robert Wood Johnson Foundation, and you could see the RX on the on the left. Physicians wish they could write prescriptions to help patients with social needs. 75% of physicians, it's the most popular prescriptions they wish they could prescribe. So that's a performance measure you can have in your county as well too. So I'm just going to fly through these slides because your county has the same prevalence indicators, and it shows that people who are low income on Medicaid, public insurance are much likely to be depressed, lack social support and family cohesion. They lack a place for their family to get together and enjoy themselves. And this is the performance measure that we have in our county. You can see amongst the 80 Medicaid providers that we surveyed, only 7% of them actually provide information about specific community resources. This was 2014, before we launched Healthy Parks, Healthy People, and we're going to resurvey them. And we're going to hope that it's no longer 7%, that we're going to at least be able to double it. That's my section.
Great. Thank you, Curtis. And so for Curtis's park prescription program in San Francisco, it's referred to as Healthy Parks, Healthy People San Francisco, but it is a park prescription program. Thank you, Curtis. And so we'll move on to our final speaker, who is going to give us the cross-sector partnerships view from the parks world. And so Howard Levitt joined us, and he's the Director of Communications and Partnership for Golden Gate National Recreation Area.
Thank you very much, Donna. And yes, as you say, I'm going to bring a public park agency perspective. We're a national park unit here in San Francisco, California. We have a very high visitation, 17 million visitors a year. We are surrounded by a densely packed, high-density urban area. We have close collaborations and have for years with other park providers at the local and state level, and Curtis alluded to that. And in listening to the presentations by Zarnaaz, Zarnaaz is and has been a national leader of ParkRx movement and Healthy Parks, Healthy People movement. Dr. Curtis Chan is the kind of nature champion that I hope everybody is lucky enough to have. And we are lucky enough to have Curtis as our partner here in San Francisco. We have been, over the last 7 years, developing both Healthy Parks, Healthy People, but specifically park prescriptions programs done in partnerships. And so the agency perspective, public agency perspective, here is the fundamental question that I think many on this webinar today have already asked and answered. Is ParkRx right for me? I think some 80 or so % of the audience have either have already undertaken or are in the process of undertaking a park prescriptions program. There's some always excellent reasons to do so. And you know this, and this is the questions you have to ask yourself, and this is targeted largely to those of you on the call who are just dipping your toe in the water of park prescriptions. If you're a public park agency, you have to ask yourself, is health fundamental and core to our mission? That's a key question. And I think the answer in most cases for most park agencies is yes. We do serve people with programs at our facilities, and at the end of the day, the outcome of that, to a great extent, we hope to be health. As you consider establishing and deepening a park prescriptions program, you ask yourself, will it add relevancy to the work that we've been doing for years? And this is what we concluded here in our national park in San Francisco. We believe that park prescriptions and linking in meaningful health partnerships absolutely adds relevancy to what we're doing as a public park agency. It's one thing to provide programs that people love and enjoy. If those programs also have an element that intentionally, mindfully contributes to people's health, that makes us much, much more relevant. We're much stronger when we're viewed as not just a park agency, which everybody loves, but also a health agency, which people view to be essential. That adds to our relevancy. It helps us, and I've posed it as a question, but here we understand that it allows us to look at our park visitors and our audiences and our prospective audiences differently. It allows us to look at audiences we may not have served as well as we could, and this includes in our area and in your area too, people with high health needs, because high health needs correspond to the very people that your agency wants to reach beyond those who are your traditional users. We had to ask ourselves as we entered the arena of park prescriptions, are we going to just take one shot at this thing, or are we going to commit to staying with developing a meaningful partnership over the long haul? And I can tell you now that we're 7 years into this, that we understand that this is a marathon. If we and our health partners are going to make an impact and move the needle on the health of this country, this cannot be a one-shot deal. For us, it's now becoming embedded in the DNA of our park. And once you've made that commitment, it's sort of there's both no reason and nor would you ever want to reverse it. So we're in it for the long haul. And finally, this is an important question to ask yourself, again, if you want to be successful and effective in a park prescriptions program, is there buy-in throughout your organization? This can't just be the domain of one or two champions in your program delivery apparatus if you're a local park agency, or even a state or federal park agency. It really has to be something that people throughout the organization understand, from your executive down to your line and field staff. Everybody has to understand, yes, this is important, and this is part of defining our agency going forward in our new relevancy. Zarnaaz referred to, and as did Curtis, to the various aspects of partnership. And we have learned, and we learned in some ways by trial and error, that every partner has a role. And this is in true confession time. When we began our park prescription program, we imagined that, oh, wonderful, we have these outstanding facilities that people love. All we have to do is prepare a little prescription pad, knock on a few doctors' doors, hand them the prescription pad, and suddenly we would have thousands of people showing up, waving their park prescriptions and saying, I'm here to get healthier in your park. That was a mistake. We began with sort of a park-centric point of view, but we quickly learned as we reached out to our San Francisco Department of Public Health, and specifically to several of the clinics, that we didn't know as much about those communities, where these communities exist, as we thought we did. We depended upon our public health partners to give us a crash course in learning what the real issues are in those communities. And we quickly learned that not only is it important that we reach out to our health partners, it was very important that we establish relationships with community-based organizations that are serving people in the communities that we were hoping to attract to our park via our park prescriptions program. So we learned by trial and error that it cannot be a park-centric program. It must be a three-way partnership with each partner having a role and expertise. We as park professionals will never be trained medical professionals. Even though we do feel we're in the health business, we're not as expert, and nor will we ever be as the clinicians who are out there serving people and dealing with health issues. Neither will we know, without a close partnership with community organizations, what those communities really need. On your screen now is a simplified framework for ParkRx, park prescription programs. This is a document that's a work in progress. Zarnaaz and NRPA, our partners and other partners around the country, have been putting together sort of what is the fundamental construct and what are the phases in a park prescription program. I'm not going to spend long on this slide. Before too long, it will be on the National ParkRx website. But this is these are the phases and the elements of each phase in a very simplified format. I don't have to tell any of you who've tried park prescriptions that this stylized little list of tasks to be done in park prescriptions will be completely different and will be unique to your own organization. So this is just a stylized approach. Of course, you plan, and you plan before you deliver. When you develop the program, as Zarnaaz made it very clear, you do that with your partners. You don't do it independently. And while you're doing it, you've got to train your own staff. We've had some excellent training with our colleagues with the San Francisco Department of Public Health, thanks to Dr. Curtis Chan and others. And we've created a community and outreach strategy to successfully deliver our PARK prescription program. And then we got started. And of course, we've had to make adjustments over the years. Zarnaaz alluded to this. It's important that you present something, but at the same time, you have to be prepared to adjust. And if you begin a PARK prescription program, I guarantee you it will look different in the next iteration than the first iteration that you roll out, even your full-scale launch. And then evaluate and adjust as needed. And that is, again, it's a mantra. You do this with your partners. You're sharing the success, you're sharing information, you're adjusting together, but you need that evaluation loop. At the same time, a lot of agencies begin exploring PARK prescriptions and they get stopped at the starting line. They get paralyzed in a way. They're waiting to have the perfect partnership and all the T's crossed and all the I's dotted. I'm here to recommend to you, and others who have had PARK prescriptions programs know too, develop that program in partnership, but give it something a try. Don't wait till you have every single thing nailed down. You will make adjustments in your program, and you will do that in collaboration with your partners. I think I'm going to stop here. I know a lot of questions are coming in, and we can answer questions collectively as we go forward. But this is from the perspective of a national park unit here in San Francisco, where we've had 7 years of experience, and we are true believers in the power of PARK prescriptions. And our partnerships with our healthcare partners and with our communities have been an absolute re-energizer for us and have put a new spark in our step as a national park.
Great, thank you, Howard. And so we are going to move right along to the Q&A session. And so I know that a lot of you have been typing in your questions, and I have a few to kick to our speakers right now. And so the first one comes from Rupert Friday, and I'd like for Curtis to answer this one. So Rupert Friday asks, medical providers ask for evidence-based, and I haven't seen much evaluation that documents benefits of PARK prescriptions. Where do I find this information, and what are the best practices for evaluating impact? Curtis?
Yeah, I think that's a great question. And I think folks in Rhode Island definitely would want evidence. I would point to like what the resources I highlighted already for you in the National Prevention Strategy. There's also a resource in the National Guide for Physical Activity. So there's a good amount of evidence as well there about getting outside and connecting with nature would promote health. There isn't the same, so I would construct the argument also with your public health partners too. There isn't the same like randomized controlled trial that, let's say, some clinical scientists would think would be needed, but public health and social services and park services typically doesn't require that level of research.
Great, thanks, Curtis. Did Zarnaaz or Howard want to chime in on that question?
This is Howard. I'll add to what Curtis said. We have a partnership going in the northern end of our park with the community of Marin City, and the public health clinic in Marin City is actually measuring. They're doing actually biometrics on the participants in PARK prescription program. So they're going to do a baseline and then a follow-up to see if there are or are not positive biometric outcomes from participating in a park prescription program using our park. And I think this question being raised, the evidence, what's the evidence behind this? It's a key one, and it's really key because funders are very interested in seeing that these things actually deliver effectively. We know from a park agency we can measure, do we have an uptick in visitation? Are people coming with park prescriptions? That's easy, but the outcomes are a little bit harder to get our arms around.
Great. And Zarnaaz, did you have anything to add to that? Or should
I would just say I agree with that. I agree, especially with what Howard just said around the evidence piece is just so important. And there's a lot of, evidence out there around the benefits of parks, around physical activity and mental health and being outside close to nature. But because this is a relatively newish model, I think there's a lot of research currently underway. Curtis and Howard mentioned a couple, and Miami-Dade County Parks and Rec is also working on a pretty rigorous evaluation right now too. So I think more to come on that.
Great, thank you. And so this next question comes to us from Sarah K. Sharkey, and her question is participation data self-reported by the patients or managed by the Parks and Rec program? I'm going to ask Howard first and then move on to the other speakers.
So in our case, we do, in our our keystone program, which is our first Saturday program, Curtis described that, and it happens in our park. It also happens in San Francisco parks. It happens actually, honestly, throughout the Bay Area. We do surveys of our participants to ask, how did they get here? Are they coming as a result? How do they hear about the program? Why are they coming? And that's sort of just that's the level of metric calculation we do. I'm not sure, and Curtis, you may refer or answer this part of it, whether they report back to the clinic that might have suggested they come to the first Saturday program, whether the clinic follows up.
I think that's a terrific question. And, this kind of relates to the last question as well, too. There's a wide spectrum of data. I mean, the data that supports the last question would add to the overall literature of research that does support health providers recommending physical activity would improve health. At the local and state level, though, a lot that what we need to do is actually changing specific performance measures of each agency. So it's still very scientifically relevant, actually, if we use, for example, electronic health records or physicians self-reporting, like the survey that I showed you, that shows an uptick of healthcare providers, let's say, prescribing parks through their electronic health records, printing up and sending something through an electronic referral. And on the park side, if like what Howard was mentioning, if there's some standardization in terms of park surveys of participants as they arrive, even describing the diversity of demographics of people attending the parks. Is this their first time of being physically active in a long time? Is this the first time they've gone to the parks? That's actually really relevant to many areas of research that we can extrapolate to be fairly certain that there is a positive community health outcome overall. So this contrasts a little bit with other types of researchers who are, for example, trying to measure specific biometrics for new park utilizers from underrepresented communities. That's a different approach, and it should require a institutional review board to make sure that the ethical issues are well addressed.
Great. And our next question comes to us from Elosa Gonzalez, and it is for Zarnaaz. So she asks, does establishing a walk with a doc or park prescriptions program create a doctor-patient relationship that may put the provider at a potential malpractice risk? Zarnaaz, have you heard of any of this from NRPA, and do you have any answers or suggestions to this?
No, I mean, that's a really good question. And, you know, I think it goes back to some of the components we talked about in the presentation and just ensuring that the location and the facilities in which the provider is prescribing their patients to is safe and well maintained and of good quality. You know, as I mentioned, things like the trails and the safety of the trails and how it's guarded from traffic and things like that. You know, I don't know the specifics around malpractice, but I know that I've heard providers being concerned about that, about the safety of where they're prescribing their patients to. So I do think that's really important, and that's where the partnership really can be very significant. And when talking about building the partnership and the roles each of the partners have to play, that really does fall on the park to ensure that their environment is safe and of good quality.
Great, thanks, Zarnaaz. And Howard has something to add to that.
I want to build on what Zarnaaz just said. It's not just, in addition, I should say, to the physical condition of the facilities, trails, so forth. Again, in working with your health partners, if you're a park agency, you're going to depend upon information from those partners as to what kinds of activities are appropriate for people coming to your park with a park prescription. Obviously, if somebody's being, someone with a severe cardiac disease is prescribed time in your park, if you're a park agency welcoming that person to your park, you are not going to suggest they go on a 12-mile extreme hike. You're going to tailor the activity to meet the needs, the health needs of people coming to you, and so we're mindful of that. But again, we depend upon the information from our health partners as to what activities are appropriate for people to do in our park when they arrive.
Yep.
And our health partners, of course, know these things instinctively and communicate them to us.
Absolutely.
Great. Curtis, do you have anything to add to that?
Nope. That sounds great.
Perfect. So our next question comes to us from Jeff Lightburn, and he asks, what programs work best within a park prescriptions program? Are they walking groups, access to fitness centers, group fitness, etc.? Open question for our panelists.
Well,
Go ahead,
Howard. Zarnaaz.
Oh, I was going to say I have seen the whole gamut, but definitely the walking programs and some of the evidence-based interventions. I mentioned Miami-Dade earlier and East Bay Regional Park as well. Miami-Dade has this after-school program that they implement with their kids, and it's called Fit to Play, and it's been around for 7 years, and it's been evaluated and has produced positive health outcomes among their kids around physical activity, changes of weight. They've measured biometrics. And so that program already existed, and so they decided to work with pediatricians to incorporate that program into their park prescription model. And so I've seen programs like that, and I've certainly seen a lot of walking programs as well. And I mentioned earlier that we did a quick and dirty survey of our members, but we've seen also those fitness programs where their physicians are recommending to their patients to go to the park for Tai Chi classes or to engage in a swimming class. So again, you know, I would say it just varies, and it really depends on the needs of the community and what the patients are looking for.
It absolutely does, and one of the things that, one of the main reasons people would want to come to a park, and one of the key things we believe they get benefit from, is social interaction. And so programs that are group walking activities, for example, have been very popular and successful for us because of that social isolation component. One key ingredient, I didn't mention this earlier, but I'll mention this now, because whatever program you put together, it's especially when you're targeting generally audiences that aren't traditionally among your visitation base, first-time visitors to your park, whatever program it is, it's important that you provide a warm welcome to your park. We found that to be possibly the biggest key to success. And then we tend to have them be not heavy cardio, but fairly low softer physical activities like walking, and walk in groups, because that social interaction is so important in parks.
Absolutely.
In San Francisco, we kind of have the three approaches that Zarnaaz mentioned. So I just want to clarify that my description was related to healthy parks, healthy people is really nature walks. So in San Francisco, there are those five sites are kind of more kind of like weekend, entire family type destination walks. That's really like a rejuvenation, recreation of thyself type walks. So it contrasts with our active zones initiative, in which they're actual neighborhood parks that we've populated thanks to our great leadership from our city park department. So they're actual neighborhood parks that, on many days of the week, there are free recreational classes, specifically Zumba in San Francisco, that bring people together to do these group exercises. So they've looked at the evidence, and there's some days of the week that they're actually like neighborhood walks, and some days of the week it's Tai Chi, and some days of the week it's something like Zumba.
Nice.
Great, thank you. And so I have one final question, and it's a combination of a lot of questions that have been asked in the Q&A section, which is, can you please elaborate on the funding structure that you have in order to implement your park prescription program? So I'm going to start with Curtis. Curtis, can you talk about the funding and in-kind support that goes into putting on the San Francisco Park Prescription Program?
So in San Francisco, there's really been no additional funding. Initially, maybe a little bit, like $15,000 or $25,000 a year to initiate several conversations through the Community Transformation Grant, maybe about the CDC's grant about 3 to 4 years ago. But since then, we actually haven't had any local funding to support our collective impact work, and that's actually somewhat impaired the acceleration of our progress in terms of being able to measure change well, to have a strong backbone organization, to have this continuous communication. So the collective impact coordination piece has been a little bit suboptimal, but promising, can be improved. But a lot of it is, the park agencies have found it a valuable tool to engage new communities in terms of healthcare providers and communities by partnering, because overall our park leaders are saying like that providing these walks are actually not very intensive in terms of staff time. They found it to be of high value. And for the health side, we've just basically just constructing these prescriptions is actually, within the normal work that we do.
Here in our instance in San Francisco, we haven't had a huge infusion of new budget to support our park prescriptions efforts, but we have sort of recast our programming in general with a health focus. And our first Saturday programs, we provide programs anyway, and so, but we have made several of them explicitly and intentionally park prescriptions. So some of that's just a labeling and branding exercise. We do, however, community outreach and reaching new audiences, and particularly audiences in our traditional park users, is something that's very important to us. And so we will and have provided bus transportation to go into communities of high health need to make it easier to come to the park. In our case, our park is located in an area of San Francisco that is surrounded by high rent districts, and not surrounded by people with high health needs per se. And so to reach the audiences we're hoping to reach, we try to make it easier as part of our overall agency outreach. And we will go and bring groups, allow groups access to the park via bus transportation provided by us, because that's part of our broader outreach mission.
Great. Thank you, Curtis and Howard. And Zarnaaz, did you have any other examples of funding that have come across for park prescription programs across the country?
Yeah, you know, when we did that assessment earlier in the summer, we did find that, now again, our respondents were park and recreation agencies, that they were drawing from a number of sources to fund their programs. A majority were either partially or fully funding their programs from their own annual operating budgets. I think about 60% of the responses had said that. But there were other sources of funding. Some came from the healthcare organization that they were working with. Some funds came from grants from outside the agencies. And also some of them had funding from grants from the local government. So those were typically where we saw funding coming from, but much of it was coming from their own budget. You know, a lot of this park prescriptions or health and wellness programming, that's in the philosophy of Parks and Recreation. So in many ways, this is kind of a natural fit for them. But at the same time, you know, we are actively looking for funding to support these programs at a national level and also at the local level as well. So going back to what we talked about with evidence, I think we need to see more evidence out there, and hopefully some more funding will come.
Great, thanks, Zarnaaz. And so that's all the time we have for Q&A, but I know that there are many more questions that have gone unanswered. And so what we're going to do is send all of the questions to the different panelists, and we'll hopefully get a collated question and answer sheet for everyone on the webinar today. And so finally, we're going to wrap up with all of our webinars and really talk about what was the importance of this webinar, which is partnerships. You've heard from our three different panelists that partnerships have been crucial to their own park prescription program, and we encourage you to think about partnerships deeply when you're starting or expanding your own park prescription program. At the national level, you can see at the picture at the top, we have a community of practice of different park prescriptions groups coming together to think about the park prescriptions programs as a national movement. And so this is the steering committee of the National Park Prescriptions Initiative at its convening in October 2014. And since Howard and Curtis are both from San Francisco, you'll see that down below on the bottom right, there's a photo of us from the Health Outdoors Forum, which was a partnership forum that happened last week in San Francisco to bring together public health and park professionals to think about park prescriptions deeper. So finally, we have quite a few resources for you to take a look at to jumpstart your own park prescription program. You can find a lot of these resources on ParkRx.org, and you can see that there are two more upcoming webinars that are talking about two distinct topics that go further beyond just partnerships. So the second one is on needs assessments and what you need to assess for in order to start and expand your own park prescription program. And then we're going to hear from three different participants on November 16th on implementation and evaluation of their own park prescriptions program. And you can register on those links. Finally, we'll have resources that will be sent out later on to all of the participants on this webinar that are resources that the panelists have mentioned during their talks on different things that you can start looking at for your park prescription program. And then finally, thank you to our sponsor, Kaiser Permanente, who made this webinar possible. You'll see that there is a final post-webinar survey that will be sent out right after this webinar, and we hope that you'll be able to take part in it. We're really trying to tailor these webinars so that we can impart lessons learned and best practices for PARC prescriptions so that you can create a robust PARC prescription program as well. Thank you, and thank you to all of our panelists on the call today. We really thank you your expertise and guidance in PARC prescriptions. Thanks so much for being on this call, and we'll see you at the next webinar.